Welcome viewers in Healthcare Today. Whenever the flat foot comes to our mind, always we think it is the condition of a children. But it's not true. Even the adult people, they can also suffer from flat foot. After childhood, they were having a very normal foot, normal arch. But at certain age, their foot started developing the deformity and it became flat. We call it adult acquired flat foot because this is not from developmental, that's why it is acquired. Why it happens and who suffers from it? Let's see from this model. This is a model of a human feet showing the different muscles, tendons, nerves like that. This is front side, this is inner side, this is back side heel, toes, and this is a leg portion. So we know that earlier also I have told you in my previous video the muscle on the back side of the medial malleolus, the ankle, on a long muscle, it's a tibialis posterior muscle that comes behind your malleolus and goes at the middle of your foot at below aspect, and it pulls the whole foot upwards and maintains the arch. What happens in some people, especially females who are above 40, usually fatty and having high blood pressure, they suffers from this condition. What happens? This tendon here, this area, the blood supply is not very good. So due to day-to-day activity, strain and stress, they get small injury inside the muscle tendon. And this tendon injury does not get the time to heal up. So all the injury this started accumulating, and after some time the health and strength of the whole tendon they deteriorates. When the health and strength of the tendon deteriorates, they cannot perform their full function. That means they cannot pull up the whole foot while you are standing, so they cannot maintain the arch. And while they cannot maintain the arch, slowly the tendon gets gain length, and the arch falls, and a person develops flat foot. So though it starts from this tendon, so the another term of this condition is called tibialis posterior tendinitis. These are medical term we call. Not only female but also the male, they can suffer from this. How we can identify and when you can identify that you may have this problem? It's not very difficult. It's just only your awareness. If you are aware enough of your conditions and you are suffering and takes a medical consult in a due time, proper time, you can diagnose this condition and avoid to develop the full foot deformity. So this adult acquired flat foot, when this starts and then becomes a full-fledged, in between time it develops with different grade. Grade 1 when there's no deformity, then grade 2 very minimal deformity, grade 3 some deformity, grade 4 is a totally deformed foot. So if you can identify this condition very early and take the measures and treatment, there is a very good chance that you may defer the progression of this condition. How you will know that you are probably having this kind of problem? There are very typical symptom for this. One can easily recognize. So this is not the model, it's a normal model of a foot where you can realize where the symptom can happen. So foot, front, inner aspect. So this area you will start having pain with some kind of swelling here, and you will be facing difficulties for standing longer and walking longer. The most difficult will be negotiating staircase and standing on your forefoot on toes. Why? So the function of that tendon while standing on toes, that means while walking, pushing off and getting up or down on the staircase, when you are pushing off a foot and heel is off the ground, the whole behind part of the foot need to be make a rigid construct, and that is done by that muscles. If the muscle is not healthy and that is not working properly, they cannot do that thing. So you cannot do this movement adequately and effectively. So if you think that you have this kind of problem, a pain around here, swelling here, difficulty for standing for longer time, walking for longer time, and negotiating staircase, don't neglect it. Please consult a specialist foot and ankle surgeon because they are the right person to diagnose and treat this condition. You can prevent the progression of the disease and can avoid the later on most deformed foot and other more costly surgeries and treatment to make your life comfortable. We care for you.